potential crisis for caregivers in the state of Texas. There is a new effort afoot to pay them better than they currently get. Welcome back. Is the state of Texas facing a shortage of healthcare professionals who work with those with developmental disabilities? There's a new coalition of providers who say there is already a crisis and it could be getting worse, meaning there are not enough people helping the countless children and adults who need lifelong care. Tiffany Batiste is a caregiver for adults with developmental disabilities.
I do it because I like to help people, and I like the smiles and the joy that we get from the members on a day-to-day.
She is, however, among a dwindling group of healthcare professionals.
I think there's not a lot of people that do what we do is because of the money. They need to be able to, be able to provide for their families.
Caregivers like Tiffany, who work for private companies or nonprofits that contract with the state of Texas, are only guaranteed a minimum wage of $10.60 per hour. And while our employer pays more, the state won't cover that cost.
We need more staff. We need to be able to pay them more so we can have good staff there.
Rachel Jelks owns Team Mobility, which runs 17 group homes that cater to those with intellectual and developmental disabilities. She's part of a new coalition called Time to Care, which is lobbying state lawmakers to raise the minimum reimbursement to $15 an hour, still less than what caregivers at state-run facilities earn.
You got to find the people with the passion, and those are hard. So then you're already paying them very cheap, and then you got to make sure they have passion for our people.
So to find folks who are willing to do that job, to be committed to that job of caring for someone's loved one for $10.60 an hour is just very, very difficult.
Steve Vitrano is also part of the coalition and the CEO of the nonprofit Avondale House, which caters to children and adults with autism. He said they cannot continue to find, recruit, and retain quality workers without the increase.
We're working.
Like everyone, our costs have gone up. Utilities have gone up, gas has gone up, food has gone up, labor costs have certainly gone up, and the reimbursements that we receive have pretty much not gone up.
Last session, the legislature did raise the rate, $1. Still not enough for organizations struggling to keep up and do the hard work Tiffany Batiste and her colleagues do every day and night, which is why they are fighting for more funding to help the most vulnerable in our communities. Just one of the many issues we expect to hear about in the next legislative session.